Healthier Together, sponsored by Regents Blue Cross Blue Shield of Oregon.
In this week's Healthier Together, we are talking about something that could be a game changer in treating things like cancer, multiple sclerosis, and a range of other disorders.
As Christine Pitawatich found, flowers may be more than just pretty to look at.
In this lab at OHSU, Dr. Larry Sherman, a neuroscience professor, is doing important work.
My lab is focused on trying to promote nervous system repair in people with diseases like multiple sclerosis, Alzheimer's disease, and other types of injuries to the nervous system.
For years, Sherman partnered with Dr. Angela Hoffman, a now retired chemistry professor at the University of Portland. The graduate students in her lab worked with flowers to see if they had any medicinal uses.
Took a lot of different kinds of flowers, all kinds of them, and extracted the pigments out of them to see if there was anything in those pigments that could be useful for humans.
Then came an exciting discovery.
So what we found is that a chemical that we identified from these flowers, these dahlias, can act to block an enzyme.
An enzyme that plays a role in multiple sclerosis, Alzheimer's disease, and some cancers.
This chemical that we've identified from these flowers can really lead us down a path to develop a drug that could help people with these diseases.
But a drug that's safe for people to use is still a long ways off. Studies still need to be done.
While it cannot itself be a drug, the best part about it is we now know the chemistry to make something happen. So we are going to be testing this.
It can take 20 years, but let's hope it doesn't. I want it to work fast, but you've got to go with the science.
Hoffman, Sherman, and their teams hopeful that with the help of Mother Nature, their discovery will eventually help people.
I think the more I learn about nature, the more I appreciate nature. What else could be out there that would be the next great discovery?
Christine Pitawatich, KGW News.
And the next step is to get grant funding to take these studies to the next level. But in the meantime, Sherman says people should not eat dahlias, or dahlias, some people like to say, because some of the plant's components are not safe to consume.
And for more of our Healthier Together stories, visit kgw.com/healthiertogether.